At Monday's 2021 budget debate, Shadow Health Minister Dr. Cummings, while singing praises to the APNU AFC for its COVID-19 response interventions made while in office, submitted that Guyanese are witnessing poor handling of the COVID-19 crisis by the PPPC government. She asserted that the government's lackluster procurement of COVID-19 vaccines has resulted in other countries in the region receiving more vaccine donations than Guyana.
Unlike Barbados and other sister CARICOM countries, who would have already received 100,000 vaccines supply, we agreed to more or less borrow and was happy to receive handouts to assist our populace. Of course, the Guyanese are glad that COVAX, the global mechanism, will facilitate the delivery of vaccines to countries such as ours.
Herd immunity, the anticipated end to the COVID-19 outbreak locally, requires at least 80% of the population being immunized with 2 doses of a COVID-19 vaccine. However, this significant milestone may not be achieved anytime soon, according to Dr. Cummings.
To achieve herd immunity, 70 to 90% of the population is expected to be immunized. But with the slow pace and the trickling of the vaccine to this country, the Guyanese populace wonders if herd immunity, whether natural or vaccine-induced, will be possible in the near future.
To date, Guyana has received just 3,000 doses of the AstraZeneca vaccine, a donation made by the government of Barbados. The vaccines have so far been administered to more than 1,800 frontline healthcare providers. An additional 20,000 doses of the Sinopharm Chinese vaccine is expected to arrive in Guyana in March. COVAX has also pledged 104,000 doses of the AstraZeneca vaccine to Guyana, with expected delivery also in March. The government has also initiated talks with the African Union for the procurement for a further 149,000 doses of a COVID-19 vaccine. It was further argued by Dr. Cummings that during her party's reign, the number of COVID-19 deaths were kept to a minimum of 2-digit numbers.
We know when COVID came to Guyana, after months, how many tests were being done per day, how many were done in months. 20 or just over 20. Persons were dying with symptoms when doctors request for COVID sample tests to be done. No, just bury them. How could we say that we had the real figures?
Temika Rodney reporting for the HGP Nightly News.